Good morning and welcome everyone to Mental Health in Underserved Communities. My name is Marco Herrera and I am a NAMI presenter, advocate, and speaker. And I am joined by Wendy Guo, CalHOPE Project Specialist, MHACC, Eliana Lopez, Peer Programs Coordinator for NAMI Glendale, and XRE, founder and advocate of Wisdom Mania Fest. And if I was gonna let them introduce themselves, but I guess I stole that from them. So first, I'll ask, what does it mean to you to be a mental health advocate or representative in underserved communities?
Hi, I'm XRE. So, what does it mean for me to advocate for mental health? Well, I was diagnosed with bipolar 1 disorder in 2016. And at that time, I was really full. Can you hear me? Sure. Thank you. I'll start again. Hi, I'm XRE. And what it means to me to be a mental advocate is really empowerment of myself and other people and to provide healing. And I was just saying that in 2016, I was diagnosed with bipolar 1 disorder. And it was really a really difficult diagnosis for me at that time. I was full of shame and I was embarrassed and I didn't want anyone to know. And then I realized in time that I could use a DBT, dialectical behavioral tactic called opposite action. And instead of being embarrassed and shameful, I could choose the opposite, which is proud and have the courage to share. And I decided to start sharing my mental health experiences living with bipolar disorder, anxiety, and OCD, and previously ADHD, which I managed to work through. And I started sharing about it in my music. I'm a musician. And then I started a self care line, and that led me to working with NAMI, doing the Ending the Silence programs, and then founding a mental health and arts nonprofit, WisoMania Foundation. So, what it means to me is to share my healing journey, whether it be nonlinear or whatever it is on each day it is, openly and proudly, and inspire other people to find their healthy conduits for healing through creativity and the arts.
Wow, thank you for that.
Good morning. My name is Dr. Kimberly Guajardo, and I work for Gateways Hospital. For me, being a mental health advocate is about giving voice to those who don't have one, being able to provide advocacy in the community, being able to provide support and resources through the programs that we offer to the clients and patients of our hospital, and being able to celebrate success stories, no matter how small, how huge they are. I think it's our responsibility within the community as advocates to remind people that the individuals who receive services from us are more than just their diagnosis, more than their illness and symptoms. And I think that's one of the things that empowers us within the community to be able to be advocates, is to bring the humanity back to the person and to give voice.
Wow, thank you for that.
Hi everyone, my name is Wendy, and like Xari, I'm also a peer myself. I was diagnosed with MDD when I was 20. Oh, sorry. Thank you. Yes. So I was talking about how I myself am a peer, and I was diagnosed with major depressive disorder when I was 20 years old. And for the past 10 years, it's been a journey for me of healing and self recovery. And now I not only work in mental health, I'm also pursuing a LMFT degree, working on my license. So to me, advocacy is not only about healing and recovery, it's also about passion. And it's about empowerment. And most importantly, it's about humanity. Thank you.
Wow, thank you for that. And what I heard repeatedly is the humanity and the human aspect of it. And a lot of what we encounter in being advocates for mental health, I feel like has so much to do with the stigma. So maybe each of you can share what you're doing to destigmatize in your communities.
I know for us at Gateways Hospital, we are working with communities. We collaborate with other providers, other organizations within the community to try to increase the bandwidth that we have to outreach to individuals who may not be able to access our resources. We're providing education. We collaborate with law enforcement, with other health providers, with medical personnel. We are working to continue to give voice, to give information, to destigmatize some of the more antiquated beliefs that I think still linger in some, some communities or areas, of being able to understand mental illness, what it means, what it looks like, and sharing with other people the resources that they can locate within the community. So by increasing our relationships, I think it allows us to spread information and education and to be able to get that out into the community to families, individuals who need it.
XR.
Thank you. In my personal life and in my artist life and at WisoMania Foundation events, I break stigma by sharing my story very openly and candidly, whether, for example, on social media, sharing what I might be personally going through and not making it always a positive public diary and just being real about where things are. And then, for example, last night I was leading a sound bath. I share a bit about like my history with mental illness and the coping skills I've developed. And I think bringing it into conversations is the best way to normalize it in casual conversations. Whether it be, for example, at work saying, I'm taking a mental health day and just being straightforward by saying, yeah, I need to work on my mental health today, or I'm struggling with this, or checking in with our friends and asking them to go deeper and open up to us. So I think creating a safe space and being open and vulnerable and sharing our own challenges in a very honest way is the best way to break stigma on a one-on-one level. And then that inspires other people to feel safe to do the same. So that's definitely how I break stigma. And also I think making mental health fun, right? That's a big part of WisoMania Foundation is we have all these fun activities with self-care in the arts, whether it be yoga, cacao ceremonies, songwriting for wellness, our festival. We try to make it a celebration to take care of ourselves rather than a burden to take care of ourselves.
Wow. Yeah, it's a celebration to take care of ourselves. Round of applause for that. I like that. That was awesome.
Yeah, so I work with Mental Health Association for Chinese Communities. Our abbreviation is MHACC. And currently I'm a CalHOPE Project Specialist, and we've actually been working on our warm line for the past 6 months or so. And it's been an intense process because, as we all know, Asian Americans face very specific barriers when it comes to mental health treatment. There's a lot of stigmatization and there's a lot of traditional Asian cultural values that are barriers when it comes to help seeking behaviors. So we really took a lot of time in developing a culturally sensitive training curriculum. For example, avoiding stigmatizing language such as illnesses and disorder, because in Asian culture, their beliefs is more that mental health challenges originate from the heart as opposed to originating from the mind, and that they put more emphasis on external factors contributing to the development of their illnesses, and that they are very big on kinship support and community support. So all of these factors we take into consideration when we're developing the training curriculum. And most importantly, I'm sure those of us who are familiar with Asian American culture or experience with working with Asian American clients, we know that they don't tend to seek help until things are extremely problematic and severe. So because of that, our warm line kind of operates more like a crisis line because families don't want to speak up. They don't want to talk about it until there is very aggressive, violent behaviors going on in the families when kids or parents need to be hospitalized. So I don't have that information on this flyer right now, right here, but our speaker are going to pull it up for us. We not only offer our warm line, both in Mandarin, English, and also Cantonese. We also have support groups psychoeducation classes, as well as recreational activities. So that's a resource I really want to share with everyone, and hopefully we could pass it around in the community. Thank you.
Awesome. And something that you mentioned in terms of within the community, and for me, community reminds me of growing up in the Latino community, not having any conversation around mental health or being exposed to even the vocabulary within mental health. My mom, very religious, she would literally try to pray it away if there was something going on or if I was expressing, not feeling 100% and seeing it as a caregiver with my younger brother. So maybe you guys can speak to what it is that brought you towards mental health in the first place, or what it looked like growing up, and what resources, what change do you feel like has happened since then? Because for me, I coming toward mental health and even being exposed to NAMI has literally changed my entire life. It's been an amazing journey because I feel like it's making myself better, and also making in those microcosms within our community, making everybody around me better. So maybe you can speak to what it was like growing up and what you see changing right now.
For myself, I think mental health, community mental health has been a very important part of my upbringing. I like to say that I was raised in community mental health. So I come from a family that has always worked within the behavioral healthcare sector, substance use, co-occurring disorders, and when that first started getting attention. So for me, when I was growing up and visiting my father at work, I was spending time with individuals who were in residential treatment, who were diagnosed with severe mental disorders and who were receiving services for those diagnoses. So I feel like I have a lot of my earliest memories were just around being in a mental health setting, and so I feel like that path was pretty much set for me in terms of what I wanted to do and what I wanted to learn more about, and understanding the work and being able to provide the support, and whether it was mentorship for staff or program development or working directly with clients. For me, the passion has always been about being in that setting where I was able to spend time with clients on a daily basis. That's been the most rewarding piece of the work that I do, is being able to know that I can, when I go to work, I'm going to be able to spend my time interacting and interfacing with individuals that remind me why I'm doing this work every day. And I think that's so important because I think it's very easy to lose sight of that. And so my drive is around knowing and remembering who I'm working for and why the work is so valuable, why we're doing what we do, and that no matter how challenging the barriers can be, sometimes it's all worth it. In the end, knowing that we're filling gaps, we are providing linkage. I think for me, that's what drives me to continue to do the work. And looking at the different sociocultural factors that impact how illness is understood in the community is so important. The work that you're doing with Asian Americans, the work that we've done in Latino culture and African American culture, understanding how Indigenous people conceptualize illness is so important to getting that linkage established. And I think you ask what I've seen change. I think I've seen that change. 20 years ago, we weren't talking about it as much, or it was a burgeoning discussion around cultural sensitivity and cultural awareness, and creating services that were individualized to people who saw the disease in a different way. I love that you're talking about your grandmother with prayer. My mother, her grandmother would, pass the egg over her, at night when she was ill, and put it under the bed, and so we have those rituals of how we heal and how we take care of ourselves. And it's meaningful to the individual. And I think that's very important. I think that you can still access mental health services. You can have psychotherapy. You can get prescribed those medications that you need, but I think you can also take that holistic approach. You have to think about wellness. You have to think about what is meaningful for you as an individual, your family, your culture. And I think those can work together. I think you can get that kind of care and make it meaningful. And I think in that way, we can reach more people and be able to increase the knowledge and the linkage by coming and addressing that individual, asking them, what is your understanding of your illness? Because it's not always going to be, well, I'm depressed. I think I'm hearing voices. Sometimes they think they're bewitched. Sometimes they think that they just have stomach pain. And we need to start with that in order to then be able to join with them. Otherwise, I think I've seen that barrier come down because we just want to tell them what we know. We want to be the expert. That's not always the best way. You're not always going to connect with people by starting out as, well, I know what's best for you. We need to ask them, what do you think you need? What is your understanding of it? And what can we do for you?
I think that highlights not only the definition, but the importance of community in that way that we can support each other. Like, sorry?
So when I was younger, I dealt with mental illness at a really young age. I didn't realize it was mental illness. And I came from a family full of dysfunction, abuse, and addiction. And my parents weren't willing to face their own challenges. And here I am breaking the ancestral trauma and writing hopefully a healthier, better future for my ancestry. And when I asked for help, I wasn't allowed to get any help because if I went to therapy and told them what was going on in my house, our household would be torn apart. So I had to suffer in silence, and I was too embarrassed to talk at school. I didn't know how to tell my friends. So I just got lost in drugs and alcohol to numb the pain. And it wasn't until I had a psychotic break in my last year of university that I started getting help as an adult, knowing that I could find that and learn to support myself. And seeing that, then I'm really proud to see how far we've come as a society. One nonprofit I really believe in that I support in Canada, where I'm from, is called jack.org. And they created also a Be There certificate in partnership with Born This Way Foundation, which trains people how to see symptoms in their peers, how to best support their peers, and prevent things like suicide, and just learn how to be a good support system for ourselves and others. And I wish I had something like that where other peers were coming to my school and normalizing the conversation. And I wish my parents didn't feel so much stigma, that they got the help and they took the medication they need to be a good example for me. But all of that has led me here today. And as a proud member of the LGBTQ plus community, there's even a really strong need in that community for mental health support. So at WisoMania Foundation, we make sure to create a safe and inclusive place, especially for the queer community and our allies. And we bring them on. A lot of our staff and facilitators are in the LGBTQ plus community. We feature them as performers, and we make sure to have all the resources available on our website, especially for the LGBTQ plus community.
Thank you.
Yes, first of all, I think that's a great question. I think it's important for us to be critical of the current system, but at the same time to also appreciate how far we've come as a society. And for me personally, I like XR, we have a lot of parallels in our story. I also grew up in an incredibly dysfunctional family. Both of my parents are have very severe mental personality disorders, and they never sought treatment because mental illness is not a condition in Asian culture, specifically in a conservative family that I came from. So because of that, there was a lot of domestic violence, child abuse, and my younger brother, my baby brother, is also um, developmentally unhealthy. He has autism and intellectual disability, and me being the eldest female and fulfilling the Asian American caregiver expectations, so there was a lot of stress and overwhelming expectations and obligations, and all of those things added together. I also went into a psychotic break in college and diagnosed with MDD. But I think through my mental health journey, I was able to actually find a lot of peers. And regardless of, what ethnicity or what race they are, I have heard of similar stories. So that gives me a lot of hope. And I just want to shout out to Project Return, peer support special. Sorry, are you aware of Project Return? PRPS, yes. Project Return support network. Yes. Big shout out to them. They had a peer specialist certification training, and basically I was in a cohort with I think about 20 other peers, and there was a lot of story sharing, and in that process I realized I'm actually really not alone. Like no matter how severe I think my trauma are, there are a lot of us who grew up in similar conditions and are now transforming and now using their wound as empowerment to help others. Um, and in terms of where do we think we are today, I am also like incredibly grateful for spaces that are opening up for Asian Americans. Historically, culturally, we know that Asian Americans have been invisible and silenced with the Yellow Pearl, with the Chinese Exclusion Act. So, me being here today and being offered the space to talk about my community, it's really an honor. I'm very, very grateful for the space that's given by NAMI. And also during the Asian hate incidents during COVID, Project Return again, along with Share LA, and they showed incredible amount of support to our community and offered us the space and the time to talk about Asian American cultural stigma against mental health. So I'm very grateful to see the change. Thank you.
Thank you so much for sharing. And something again that stands out from what's being shared is the idea of linkage and the idea of communication and sharing and having these spaces be open and just be able to express not only what we understand, but even the things that we don't understand. Because for me, anxiety didn't look like anxiety. I thought I was just, not having a good day or, something to that effect. So I really appreciate the forward motion of the conversations and the vocabulary that's being taught, even just in having simple conversations. It's not always going to be a seminar or a panel of some kind. It's going to be in the spaces that we least expected, that things come out. My dad has learned how to process a little bit of his trauma from 50 years ago. And I'm just, blown away by the idea that there's still development happening, even in somebody that I looked at like a superhero at some point. I thought nothing could bother him. And then to hear what did bother him that he kept from his children and not expressing for, 30 plus years was mind boggling for me. Maybe you guys can speak to sometimes in being able to share these resources or this information. I feel like there's a lot of misconceptions, or there's perceived barriers that aren't really total barriers for conversations that we're having. So if we're offering resources, a lot of times it could be financial, it could be access driven. Maybe you guys can speak to some of the things that you've encountered that seem like barriers, but there's ways to get the access or to get the information necessary.
I think for myself, identifying resources within the community has always been a big piece of that, and then being able to share those directly with either clients and or their families. I've worked for Los Angeles County providers for over 20 years, and I think NAMI was always the first resource that we offered to people. Always, have you heard of NAMI? Are you aware of the work that NAMI does? Getting them linked up with the NAMI chapter in their area so that they can learn, whether it's about how to understand their loved one's illness, how to find those resources and get information, how to navigate the system. We get a lot of cold calls at every day at work. I have my son is at home, he needs to get housing, how can I do that? Taking the time to be able to provide that information, whether it's a 1-800 number or giving them a form or sitting down to explain how to get that access or that entry into this great big system that can be very daunting. I think the barrier a lot of times is just not understanding what it is that we really have at our fingertips, but how do we get there? So for a lot of us, we work with our staff, we work with our programs to be able to have that information. We need to be able to talk about where that access point can be. Well, what is it that you need? Do you need to be in the hospital? Do you need housing? Do you need, vocational training, and being able to steer them in the right direction? There's a tremendous amount of gratitude when you just give somebody 5 minutes, 10 minutes of your time to help them understand how they can get entry for themselves or their loved one into the system so they can get those services. NAMI's been a big one. Project Return. I love that you mentioned Project Return. We used to partner a lot, in different organizations I've worked with Project Return. They would come in, they would, be able to have panels with our residents and our clients and provide firsthand information about their own experiences. I think that peer-run services, wellness centers, client-run centers, these are all so important because it empowers people to get information, and it provides lived support. People who understand, who have been through the system, who understand how intimidating it can be. I think that's very important as well, is supporting and uh, giving more voice and more understanding of a lot of the client run advocacy groups and organizations that are doing a lot of work and need more collaboration with entities, larger entities, so that we can get those resources out to our clients and families.
Thank you.
There are so many amazing resources out there. And when I went through a really severe depression some years ago, I found it really hard to locate all of them. So I spent tens of hours finding everything I could possibly find. And I curated my own list, which is on my music website and also on my nonprofit WisoMania Foundation.com, with everything from self-care to working with a professional to get on medication, to support groups, to podcasts, to free yoga, to really everything I could think of, self-care and creative related, for your mental health and medical as well. And like you said, NAMI has tons of resources. I put together a list of resources specific to the LGBTQ plus community in light of marginalized communities. So I'm just going to go through those. For some reason, it clicked off as I said that. Okay, so I'll just remember from the top of my head. So there is the Trevor Project, which you can contact them 24/7 by text or phone. There's It Gets Better, which is for LGBTQ plus youth. They have over 1,000 resources and links on their website for support for the queer community. There's also Music Cares. Twice a week, they have LGBTQ plus support groups specific to musicians. They also offer grants for therapy for musicians, which I have gotten free 10 sessions for Music Cares, which is run by the Recording Academy. There's also resources for the LGBTQ plus community on the NAMI website. And there's the LGBT Center in LA. There's a few of them. They have support groups, one-on-one therapy, family counseling. So if you are financially unable to get one-on-one therapy, support groups is a great way to get some help you need and also meet other people going through similar challenges. And then as well as a resource that I mentioned before, which I think is so important, is the partnership with jack.org and Born This Way Foundation, the Be There certificate, a great way to get training to help ourselves and others. But the NAMI website's a really great place to find resources. And again, at WisoManiaFoundation.com, you can find everything, including NAMI there. That is so important. Thank you so much for sharing that. Also, there's a trans crisis line, which is another one I didn't mention, really important. It's trans people helping other trans people in crisis.
And if you would like more resources, once we're done here, there is, I think we had an email thread with a whole lot of resources. I'm not sure if they were compiled and brought out, but we can share those obviously if you would like.
Yes, thank you. And again, big props to our MC, another great question. So in terms of barriers, I really appreciate, again, being recognized in that Asian American community is an underserved community when it comes to mental health, because I think historically we tend to have the model minority perception of Asian American individuals, highly successful, academically achieving, high income, but really I think those of us within the community, we understand how many issues and problems, intergenerational trauma, family conflicts goes on behind closed doors. So I think that has a lot to do with the cultural historic background of Asian American as a whole, because we've consistently been seen as foreign. And in order to acculturate in order to acculturate or assimilate better, we are pressured to be high achieving, to be successful. So therefore, we could be protected against racism or discrimination. And as we know, the model minority myth was actually coined during the civil rights movement to condemn African Americans. So it's really a tactic created by white supremacists at the time. So again, I'm going back to my main point. I'm really glad that now we're recognizing that Asian Americans are actually underserved when it comes to mental health services and access. And in terms of barriers, I think there's a lot there. Stigma is definitely a big one, language barrier, cultural differences, racial and ethnic discrimination. Um, and I think in terms of what you could do to help eliminate that stigma or help Asian American friends or family, like I mentioned, I think language is a big one. When I worked for the LA Department of Mental Health doing mental health promotion in the San Gabriel Valley community, it's really, really hard to get Asian Americans to come out and listen to our mental health workshops because we use the word depression and anxiety disorder. So when they see the word disorder, they're not going to come out when they see the word illness. So to us, that's highly stigmatizing language. So what's interesting is that we kind of have to like be creative around that. We market it and we spin it around as a workshop about mood management, a workshop about stress reduction, a workshop about interpersonal communication. And through those lenses, we're able to kind of introduce the topic of mental illness. So, having been a part of the mental health system, I do see the areas we can improve in. Like, for example, the materials cannot be translated directly because that's just not going to work with some ethnic groups. I'm pretty sure, we see the same thing in Hispanic or, Native American groups as well. So I think cultural sensitivity approaches is very, very important. Yeah, thank you.
Well, thank you, Wendy. And yes, I mean, just thinking in my experiences of being in the Latino community and culture, and like you mentioned, the minute that you say depression, the minute that you say, you need help, that's already a huge turnoff. It's already a reason why I want nothing to do with it. I'm fine. Sometimes I'm tired or I'm stressed, but I'm fine. I'm fine. That is the crux of where the conversation and the opening of the conversation, so that it isn't just in our worst moments that we're talking about mental health, that it's in our often conversations as often as possible in my case. And I think one open-ended question is, how can we get mental health to find people first? And this is a thinker, because I saw the question and I was like, wow, that's pretty awesome question. So I'll give you guys a second to think about how can we get mental health to find people first?
I like that question. I think we're doing it in small ways already, by making mental health and behavioral health care more present in elementary school, middle school. And we're talking about wellness and, anti-bullying and all of these different things that I think really are talking about feeling safe, feeling whole, feeling healthy. So I think we're starting to make movement towards that. To me, that feels like mental health finding you first, if to paraphrase your question. I think making it part of the day-to-day discussion about finding places to feel safe, whether that's in your home, with a friend, with an organization, with something that makes you feel that you are taking care of yourself. I think that is finding us first, and before it's too late, before we are in crisis, before we have lost all of those things that help us feel like who we are. I think that we're starting to find small ways, and the culture is moving towards making it okay to talk about not being okay. And so we wear the buttons, we put up the posters, we celebrate it every May, but I think we have to talk about it every day. It's okay to not be okay. And I think in doing that, we start that conversation, and we make it part of maybe someone's day who wasn't thinking that they were going to be talking or thinking about mental health or how they're feeling that day. And so in those small ways, I think we're making the movement towards that.
Love that. Thank you.
When I think of how does mental health find you first, I think of the initiative of proactive versus reactive care. So making it part of our traditions, whether it's family outings or time with our friends or celebrations, intertwining wellness and healthy conduits for healing into our daily life, not because we have to, but because we want to when we are well, and developing these coping skills so we have them at our fingertips. So when in crisis, we already have this colorful tool belt full of different things we can do to bring into our lives. So for example, that might look like, say you like doing Sunday tea with your friends and saying, hey, why don't we do a 5-minute grounding meditation, and taking these initiatives, these opportunities to bring in wellness, to share with some people who might not take the time so they learn something new, and just being an example of somebody who values self-care, creativity, wellness, however you see it, and really just talking about it. Say you're leaving a coffee break with your friend and you have therapy that day, and saying like, yeah, I gotta go, I have therapy in an hour, and like bringing it into conversations, making it feel casual and not like a big deal to be taking care of ourselves. Because I know I waited, and luckily I was an athlete and I was in the arts growing up, so I had some conduits for healing. But when I was in crisis mode my first time, I did not know what to do. And so I wish there was more of a culture that I grew up in that was supportive to wellness and really made an emphasis on taking care of our well-being, just because it's enjoyable, because it's supportive to our health, not because it's mandatory to fight off illness. Because lots of ways to take care of our mental health can be enjoyable and just beneficial day to day.
Absolutely. Thank you so much, XR.
So again, I think this is a very important question. So how do we make mental health services client center so that it's not just client center in the therapeutic practice, but also in our community as well? And I want to share a little story of me working for the Warm Line for MHACC, the organization I'm with. Earlier, I mentioned Asian Americans don't tend to seek help until it's too late. So I got one of those calls a couple weeks ago, and this mother, her son's condition is extremely severe, schizophrenic, bipolar, and has been isolated at the house for about 5 years and abusing his parents. And the mom was just crying to me for hours on the phone because she does not know how to help him. She doesn't speak the language. She is still isolated, have not been able to assimilate and acculturate into American society, does not know how to navigate the resources. And she really, really wants to help her son. She can't just abandon him because kinship support is important in our culture. So how do we help her? And I was very curious how she was able to get our organization's number. Given some groups, it's very difficult for them to access and navigate the healthcare system. And she said, I just had a conversation with a Caucasian gentleman at the park, and I had no idea that he works in mental health. And I was like, wow, that's amazing. And I think that is a great example of things that each of us could do from today on to help those in the community. Maybe just start up a conversation with them. How are you doing? You look stressed. Is everything going well in your family? So it turns out that this gentleman is part of one of the support groups in the local area. And he knew of our organization, and that was how she was able to get connected to us. And she said that prior to calling our organization, she was just hopeless. And her husband have no idea what to do. And this was like a ray of sunshine casted into their lives. Yeah, so that's just a little inspiring story I heard, and I want to be able to share it with everyone and empower you to help those around you.
Thank you so much. There's a whole lot of empowerment going on just in these conversations, and I think it was touched on the consistency of them and just making them as often as possible, every day if possible. And for me, it just represents that there are lights at the end of all of our tunnels, regardless of where we can feel we are at times. And so I would like to open it up if anybody has any questions in the audience. I think we can figure out, either you can just yell it up here. Han?
Information, but I wanted to say thank you to the panel and for the wonderful questions that you evoked. I have already become an advocate by taking this. I took a picture of it, and every text group that I am in that has 10, 15, 20 people in it, I just sent this to them and I said, hi, I'm at the NAMI conference. Here's some resources and information. So thank you for your ideas, and thank you for your information, and thank you for your support in this area.
Thank you so much. We received that. And just to touch on that real quick, I feel like it feels like there's a leadership sense when it comes to being an advocate in your community. I myself am an introvert. It's hard for me to even get up in front of people sometimes, but this conversation, it's a passion piece of my own. And so I turn into, yes, I've got all these resources, we can talk about it. And so I'm just saying, you don't have to feel like you're a leader or that you're anybody in particular that is representing mental health. You can just be a satellite and just be able to give, little bits of information at a time. It doesn't have to be, full on leadership role. So questions, go ahead.
For Wendy, I jam is suicide prevention. I've studied this for a long time, and kind of parsing data from the CDC apart, we see that South Korean folks within the Asian culture, because there's so many different Asian cultures that have been pointed out, that particular subpopulation of being Asian is twice as likely to die from a suicide attempt than any other group of Asians. When I was the clinical director at the Didi Hirsch Suicide Prevention Center, we actually opened up a direct line on 98, well, it was before 988, but to the Suicide Prevention Lifeline, specifically geared towards the Korean community. And then we had an outreach person who would go into the community. That population is different. Tell me what you know about it and what you think is the most effective way to really help with that problem to the degree that you're familiar with it.
Yes, thank you so much. First of all, I want to recognize your awareness, because actually a lot of mental health professionals, even they're not aware of like the incredible diversity within the Asian American community, 56 languages, Eastern, Southern, PI, Pacific Islanders. I think that's something that has a lot of research in the academic sphere. Each particular group actually have like their own manifestation of mental health symptoms. And for example, gambling and addiction is a big one in Asian American communities. So, you know, a lot of successful, high achieving, high income individuals, you may think that they're fine, but they may be actually incredibly addicted to gambling. And that's kind of like an invisible symptom that we don't really see. And then from what I know with, I'm ethnically Chinese, but you know, I do have Korean friends, and I'm a little bit versed in that culture. I think it goes back to cultural historical context. So if we look back in history, Korea and Japan during the Tang Dynasty heavily influenced by Chinese culture, religion, and education. So a lot of it is built on Confucianism and the idea of social hierarchy, family hierarchy. And China, you know, and due to its different movements, Cultural Revolution, and now socialism with a capitalist element, it has evolved to embrace a lot of you know, Western values and idea, consumerism, materialism. I think Korea and Japan as well, they kind of pertain that conservatism, and as well as expectation for a homogenous society. I'm not sure if you guys have been to those Asian countries. I think if you're physically there, you would be able to see. It's just so um, it's just so incredible how you see a lot of people dressed in very similar clothing, similar hairstyle, and very different to Western society where we value individualism. Everyone there is trying to fit in. If you're any different, then you're seen as not desirable. So I think that has a lot to do with Confucian values as well as collectivistic society traditions. Thank you.
Thank you. Good.
So much. I work for the Department of Mental Health as a mental health promoter, and part of my job is to outreach the services to my community. But I always find my struggle is with the clergies, like with the people who maybe in the religious entities, they don't support, they don't invite me to really tell the people. We have about 13 educational mental health classes for people to learn about stress, to learn about anxiety, to learn about depression. And somehow my difficulty of these people saying, hey, yeah, come over, teach our people, because in these, like, imagine it's big organization, they have a lot of people with members, but they don't support us to really educate people about mental health. What can we do? What can we tell them to really open the doors for us and allow us to reach these services to people? Because it's the right of the people to know these services. It's the right of the people to know where they take their kids if they have addiction, if they have mental health problems, autism. So what can we tell the people to just tell me, what can I do when they say, oh, we don't want the word mental in your work, like what you said earlier. Thank you so much.
Collaborated
Yeah.
together.
No, we don't.
Yes, we did. We tried. So I actually, I resonate with exactly with what you're saying. I completely understand because we come from our own community also as well, where it's really hard to difficult for us to get them in the faith-based organization that we belong to. So I'd actually brought Ruby into a faith-based organization. I actually got in trouble for that. So it's been really difficult because they're just like, well, you have to change the flyer. You can't have mental health on there. You can't put, can't put anything about depression because people won't show up. Because if they show up, they're going to be like, oh, that person has an issue or a problem. So that's an issue that we've been having in the faith-based organization. And like I said, I did bring her in, and then what we decided to do was just have it on Zoom. Well, just put it on Zoom. That way we have everybody's email. But that's just an issue that we're going through within the community.
Yeah, off the top, I believe XR might have mentioned just kind of like the slight variations in calling it, something very direct, like, mental health or depression, in specific. I think if you're trying to draw people that are dealing with those situations specifically, then yeah, I would say something like a Zoom would be a good idea, but also just changing the language, I think is probably like the most surface way to kind of work your way into that. If the panel has any other suggestions.
Yeah, it takes like 1 moment.
Can we pull
Ah,
up,
Thank
can we
you.
pull up Wendy's slide?
Wendy made a good point earlier about using, different kind of language. So maybe instead of mental illness or mental health, it could be health and well-being, you know? Yeah, so then maybe you just do DMH and just use your acronym. Maybe there's a way to bring in nutrition and physical health, combine it with mental health, and talk about we want to bring health and well-being to your community and have a little segment about nutrition, about physical fitness, and then mental well-being. I don't know why mental illness is so triggering. I guess it's the stigma. There's no problem saying when someone has diabetes. I don't know why we should be so ashamed. Hopefully that will change over time. But I think if there's a way to tie it into physical health, because mental health is physical health. So getting into like your well-being of your body, and then also brain health. Even brain health is another way to say mental health, which could be a little less triggering. But do you have any suggestions, since I know you've had to do that for the Asian community?
Yes, thank you. Yeah, I'm going to acknowledge my blind spot. The religion sphere is not something I'm too familiar with. So I'm going to acknowledge my ignorance on that. But what I do want to say is that the current psychological therapeutic approach, or what we're learning academically as well as in practice, is Eurocentric. So essentially the system we have set up is built by Westerners, which, the method in which they connect with individuals that are not grown up in the Western society does not work with people from other cultures or ethnic groups. So I do want to say that I think it's time for us to start appreciating and learning other ethnic groups' religion, cultural practices, and see how we could morph mental health accordingly. Because meditation and mindfulness has been shown to have incredible treatment result in treating depression and anxiety and even more severe cases. So I think that's actually something that as a whole, academically and also in practice in the field as well as system, we could embrace to learn about the benefits of spirituality and religiosity, having faith, having hope. All of those are incredible healing factors in mental health. So, perhaps, you know, um, educating on how having faith or having hope could be an incredible healing factor to improving happiness. I think maybe those may make it more attention grabbing. Yeah.
I think to add to that, consistency and persistence, I think, is something that I've seen, have its benefit and way, because in the first few times that you might hear it or be exposed to it, there's going to be that, stigma wall. And little by little, if they see that it's just, another conversation, it's trying to give people a way to be well, not talking about how ill they are, but how a way to be better. And I think that's a bridge and a pathway to success in that area. Any more questions?
My name is Takako Augustusson. I belongs to a Japanese speaking support group under NAMI South Bay. I have a question to Wendy. We have a big handicap, which is language. I think over 90% of our members did not graduate school here. So I'm also limited English, but we are getting together, share together, care together, help together in Japanese, how we struggle with loved ones. So how you resolve that language gap when you go to Social Security office, court, and doctor's office? I am a limited English, but even though I can help, but I'm not 100% English speaking. So I ask you about how you support your community.
Yeah,
People.
thank you. First of all, thank you. I'm actually very well versed with NAMI South Bay. I actually worked with Miss Naomi Mitsushima. She's one of the facilitators for NAMI South Bay. So I think that's a very broad question. I think our society as a whole is not doing well enough in terms of inclusivity. We do want to be able to cater our services to as many ethnic groups as possible, but a lot of times, like for example, the Japanese, the Korean, and the Chinese communities, we're not getting the support that we need. And I think that requires all of us in mainstream culture to be allies and advocates. I think policymaking requires voices to be amplified. And I do want to chat with you individually afterwards, if you may. Really, thank you for that question.
Thank you so much.
Just to quickly note, we have about 5 minutes left for Q&A.
Thank you. Anybody else? Go ahead. Absolutely.
I am a support group on the west side, and I have probably about 5 Asian families. Okay, I try to help each other. I try to match them so they can understand. But the problem is the mothers don't speak any English. It's the daughter or the brother or the son. And it's really hard if we don't have somebody to help them. So I just did this. So now I'm going to see if I could share this, and I appreciate it, but they really do need help. I'm so glad that they're even calling and reaching out. That's the most important thing. Thank you for doing what you're doing.
Well, thank you so much. I'm really glad to hear that you're helping individuals within our community. Yeah, so I have it pulled up. That's the resources my organization offers. And I also have my business card here. So if anybody, have families or friends that they know of that are in need of help, please pass the information along. Thank you.
Go ahead.
My name's, I was gonna ask you if you knew Elaine Pink, but I
Oh,
saw
yes,
that
yes.
you, like, the type's so small, I thought it was OC, it's not CC. I'm on an Orange County Behavioral Health Advisory Board. Every county in California has a state mandated board, legislative welfare institution codes that we don't always get to do. Now, the state requires cultural competency beyond just language publication. So I think we really need to fight more for that. And I had less of a question, though I want to connect with you, was I wanted to thank you all for what I think is the most important thing people can do. And that is to eliminate self-stigma by sharing your own personal story. I think when the people who work in this business can model that behavior for everyone else, because we're like the gay community who can come out of the closet at some point, but we also have these difficulties connecting with people. And you can't just tell people not to have stigma, you get rid of self-stigma. So the other thing I would think about isn't on the language is to empower people who speak the language, who aren't necessarily behavioral health providers. Maybe it's another peer type situation where they've lived a journey and they can have empathy for the journey and just start to add those people to the workforce. Because it's very hard for anyone to talk about this stuff, much less not be able to be in a room and talk in your native language, so that you can at least share. And what you guys did is a great job of explaining why you just changed the flyers. I mean, county has money for that stuff. So thank you.
Thank you so much. And with that, I think we're at time. A round of applause for our panel and yourselves. We would collectively like to thank you for listening, for being here, and you guys are now empowered to go and be in every community, not just underserved communities, to be the voice for the people that feel like they don't have one. Thank you so much.
Thank you.